Hello, I'm Dr. Peter Dillon, the Medical Director of Tanana Valley Clinic's First Care. We're standing here in front of the Respiratory Center. Our main First Care building now is where we take care of patients who have concerning symptoms for COVID-19 or the coronavirus. We've made a lot of changes to help keep you, the patients, as well as our staff safe, and we've very recently started seeing patients in our main building, and I'd like to show you around, let you know about some of those changes that we've made. So come with me, we'll take a walk. So we're now at the main entrance to the Tanana Valley Clinic main building, which is where our family medicine practice, internal medicine practice, pediatrics practice, as well as some of the subspecialty practices are located. And we're going to walk through, I'll show you some of the changes you can expect when you come to First Care, which is now located on the first floor of this main building. As we walk through, we'll see some of the changes we've made to help keep you and our staff safe. All right, well, after we've entered our main lobby of the main building, you may notice some things are different or look different from the last time you were here. We've got our screening table set up with a plexiglass barrier to protect you as well as our screening staff. And these folks are gonna help appoint you and get you in the right direction. They're gonna give you a mask to cover your face, help protect you as well as protect our staff. Ask you to perform some hand hygiene with hand sanitizer, keep our hands clean, and then they will perform a temperature screening as well as ask you a series of questions that are designed to identify if you're experiencing symptoms of COVID-19. Now, if you are experiencing symptoms of COVID-19, you'll be directed either to our respiratory center for testing and an evaluation, or if you'd rather reschedule with your provider, they will help facilitate that as well and get you set up for a visit at a later date. Now, after you complete screening, what will happen is we'll walk you through and either head upstairs to your scheduled appointment, or if you're here to see us at First Care, let me show you. We'll walk into the First Care lobby area. So after meeting our screeners and passing through the screening questions, you'll see our very empty waiting area is one of the measures we're employing to help keep you safe. Social distancing is very important, and not congregating in an area like this is how we are helping to keep you safe. You'll see our sign, which will direct you towards First Care or the other services that are offered here on the first floor. And after walking over, you'll see our registration team protected by plexiglass barriers, again, to keep them safe, to keep you safe. And the goal is to walk you immediately back towards an exam room to complete your visit. If we are full or there are other patients who are currently getting their care, we will have you wait in your car until we can get you through your visit with us at First Care. So after you've been put in one of our exam rooms, you'll be greeted by our providers, continuing to emphasize our very clean hands and hand hygiene. And what I want to make sure you understand is how much effort we're putting into keeping you safe with our rooms being cleaned very thoroughly. Our environmental service team deep cleans in between each visit. As well, we've staggered our appointment times in order to better accommodate more patients in a safer way. Again, trying to keep you safe from the person who was in this exam room right before you got here. So we're using this space in the internal medicine clinic. New equipment, same care that you're used to at First Care, just in a different environment. For patients who are getting their care at our respiratory center, the traditional First Care building, you may also notice a few changes. Our providers and staff are wearing gowns, gloves, eye protection or face shields, as well as masks that may be a surgical mask or an N95 respiratory protecting mask, depending on the nature of the visit. Additionally, we've installed air movement systems to reduce the risk of airborne infection spread, and we again are taking the cleanliness of each exam room very seriously, and our environmental service team deep cleans between each patient visit. Safety is our top priority at First Care, whether you're a patient seen at our respiratory center or in our new space over in the TVC main building. Our First Care team wants to thank you, Fairbanks. You stayed home and helped us flatten the curve, and now we're here ready to deliver the care that you need.